Ginger is among the most commonly used pregnancy remedies. A lot of women use ginger during the first and second trimester to ease morning sickness, so any nausea and vomiting that may come up in early pregnancy. Also, ginger is commonly used postpartum. It's a part of many Asian traditional confinement diets, and it's also used to support breast milk supply or breast milk production postpartum. So is ginger safe to use during pregnancy and breastfeeding? What do we know? You can check out the latest Herbal Doula monograph on ginger that's out if you want all the details and the links to all the hundreds of studies and textbooks that are there. So I will sum it up for you here. Yes, ginger is likely safe to use in pregnancy. Most professional and herbal associations agree on this, especially US and UK associations, with some European associations being more restrictive. But there's really a lot of data. So we have lots of studies that looked at ginger use in women, and most of these studies found no issues, so no increased adverse outcomes in women or their babies, no increased risk of any malformations or stillbirth or any other issues. In this sense, ginger is used in doses. The doses that are typically considered to be safe and recommended are 1 to 2 grams of ginger, and this is really confusing for women. So this refers to dry ginger, and I've seen women say, like, how can I use that? Like, that's such a small amount. So this is 1 to 2 grams of dry ginger. If you're using fresh ginger, the amount is 2 to 3 times higher. So this would be up to, for example, 6 grams of fresh ginger. That's about a teaspoon of ginger that you can use in tea or food. Postpartum and during breastfeeding, we also have a lot of traditional medicine data, especially from traditional Chinese medicine and also from Ayurveda, where ginger is used postpartum and it's a part of the diet. And we also have some clinical studies that use ginger after birth, usually to support breastfeeding or to reduce pain, so postpartum like perineal pain, and also some studies that tested ginger for reducing after pain. So this is really great if you're if this is your second or third postpartum where the after pains get a bit stronger. So also like really no issues in terms of breastfeeding. One issue that did come up is like, does ginger increase the risk of postpartum hemorrhage? I'll cover this in additional posts, but the short answer is no, especially no, not at the recommended doses and if you don't have like really high bleeding.